Have you set your goals yet? Did you set a goal to be more confident? Did you set a goal to be more connected to your body? Or did you set a goal to want to live a longer, healthier life? Whatever your goal is, just make it clear. Know your why, and this way, when you're in that workout, you know what's going to get you there. You know what's going to push you through to the end. You know what's going to drive that intensity. You know why you're doing it. Be clear on that. Set some goals for yourselves. Set some short-term goals. Set some long-term goals, and then make sure that you break them down into actionable steps so that you can achieve these goals. And then once you set these goals, you and I can help keep you motivated and on a path towards achieving those goals. All right, let's move on. I want to talk about assessments. The first assessment I want to address and talk about are medical assessments. So as a trainer, the first thing I would do is hand you over a PAR-FQ, which is a basic questionnaire, and it's going to list your prescribed drugs, whatever you're taking, whatever your doctor's recommended for you, whatever past injuries you may have had, whatever past illnesses you may have had, any medical conditions, just list them on the PAR-FQ so I have a better understanding of where you're coming from medically. After I have a vague idea or a better understanding of what it is that I can expect from you, then I want to know, are you working with a team of professionals? Are you going to see your primary care physician on a regular basis? And if so, are they recommending anything pertaining to your health, anything that can help improve your health? What recommendations are they giving you? Are they scheduling blood tests? Are they doing routine blood tests from you? Do they have a record of this? Now, I like knowing this information because I use the blood test for performance analytics. So I'll talk about that in another video, give you guys more detail on what you can see in your blood test that affects your performance, your health, your longevity. Okay, are you working with a psychiatrist? Mental health is a big thing. It's definitely not something to just sweep under the rug. Definitely talk about it. If you need help, definitely go seek help. Maybe you're suffering from anxiety. Maybe you're suffering from depression. Maybe you're suffering from some sort of past trauma. Now, I often hear personal trainers talk about that they feel like a psychiatrist some of the time because we get very intimate during the training sessions. We talk about your stories. If you're with a trainer, you're with them 3 to 5 hours a week, and you just talk. You gain a better understanding of each other. And we can't sympathize with all your experiences, but we try to empathize, gain a better understanding of where you're coming from so that we can help you and we can motivate you. Or sometimes maybe you just need to vent. Are you working with a physical therapist? Do you have any past injuries? Did your primary care physician ever recommend that you go to see a physical therapist to help any injuries that you've had? Maybe you've broken a leg, been in a car crash, and have like neck issues. Well, I want to know if you're going to see a physical therapist to help you with those injuries. Or maybe you work a labor-intensive job. So I would recommend that you go see a physical therapist to make sure that your biomechanics are optimal. Make sure that you have those good movement patterns, you're moving efficiently so that you don't get overuse injuries, so you don't get muscle imbalances. Now, I'll still address these in the physical assessment and how I look for them. And if you have anything too severe for my knowledge, I'm going to recommend that you go see a physical therapist, somebody who's more knowledgeable in addressing the biomechanics of it. Are you working with a chef or a nutritionist? Now, for a lot of busy people, if you don't have a lot of time on your hands, you're finding it hard to get to the gym, cooking and cleaning dishes, that's a great thing to delegate and send off to somebody else who can help you with that, to open up your schedule, open up your time. Hiring a personal chef or they have meals that you can just order and bring to your door, that would still fall under the chef category. You're still delegating out a task to somebody else that can open up time for you. And are you working with a nutritionist? Are you having somebody look at your diet? Are you having them see what food you're eating, the quality of the foods? Are you getting the micronutrients that you need? Are you getting the vitamins, the minerals? Are they doing testing to see how your levels are? That is great information to know. Now, are you working with an endocrinologist? If you're having hormone issues, you want to go see an endocrinologist, have them do a study, have them do blood tests, have them check your levels routinely. And then finally is strength and conditioning. This is what the personal trainers are for. This is what we love doing. Once we have a better understanding of your medical history and we know what we're working with, then we can tailor a program to your specific needs. Not everybody needs the same cookie cutter program. You know, you want something tailored to you. What's going to work for somebody may not work as well for you and give you the best results. So, yeah, that's why we do the medical assessment. That's why we want to know all this information so we can help you better. There are a lot of great programs out there. I can also recommend some for you. Probably do a video on the top programs that I like, who has good programs out there. But that you want a team. You want a team on your side. All top level athletes, all top level performers, even business people, they have teams. You want a team on your side. You want to know who's on your team. So I will see you in the next video. I'm going to break down the physical assessment.